Hello everyone, and welcome to Session 3 of the Global Black Feminist Reading Circle. My name is Randie Henderson, and I am one of the Black Feminist Reading Circle members of this online group. This session runs from January 20th until June 2nd and includes 2 week-long breaks. Our democratically selected reading material is Harriet A. Washington's book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. Our book group meets each Tuesday evening from 6:30 to 8 on the Google Hangouts on Air platform. You may find the Global Black Feminist Reader Circle on Google+, YouTube, and Facebook, and always feel free to join us in reading our story together.
Welcome everybody to the Global Black Feminist Reading Circle, where we are reading for change. We are all in a good mood and happy tonight because we are closing the book on Harriet A. Washington's Medical Apartheid, The Dark History. She ain't never lied. The Dark History.
Yes.
Of medical experimentation on Black Americans from Colonial Times to the present. We actually finished reading last week. You are invited to join our community on Google+, or follow our Facebook page, or look up the hundreds of videos that are archived on YouTube under the name the Global Black Feminist Reading Circle. And my name is Michelle Odom. I'm one of the co-hosts of the group, along with Randie Henderson, who will join us shortly. And I'm located in Brooklyn, New York.
I'm Thaddeus John Bell, and I'm a practicing physician in Charleston, South Carolina. And one of my passions is dealing with health disparities that affect African Americans and the underserved.
I'm Joel JJ, hailing you from Charleston, South Carolina. I'm glad to be here amongst all the women and one other man.
Let's stay in the South, Georgette.
Okay, my name is Georgette Moses, and I'm in Columbia, South Carolina. And I'm happy to see everyone here, and I'm ready to decompress.
All right. And the extreme north, Vanita.
Good evening. My name is Vanita Walker, and I'm joining you from Cromwell, Connecticut, which is the extreme north of Connecticut, right before you hit Massachusetts. Welcome.
And finally, Kim.
Hi, everybody. I'm Kim Brandon, and I'm also in New York City, and looking forward to this conversation.
Thank you.
Hi, my name is Randie. I'm watching from Atlanta, and I'm happy to see everyone.
So does anybody have anything else they want to add about lessons learned from part 1?
Now, one of the things that I would like to say is that there are some negatives and some positives for not participating in clinical trials.
Okay.
The way that experimentation that was done on African Americans years ago in most cases can't happen now. It cannot happen.
It cannot?
It cannot happen. That's exactly right. All right, and the reason that it cannot happen is because the federal government has, and I'm blocking on the name of the organization, but every medical school has this in their organization. Anytime any type of research is going to be done, the federal government has to come in, and they have put together a board of scientists and community people to look to see whether or not the quote unquote experimentation that's going to be done is going to be detrimental to the health of people. If it's going to be detrimental to the health of people, it won't even pass the board that makes this research available.
Are you talking about the institutional review boards?
That's exactly right. Keep this in mind. One of the reasons that we won't be able to find out a lot about marijuana is because we already know that marijuana does a lot of bad things to people. All right, and the institution review board, no matter what kind of data is going to come out of that, they're not going to approve that.
Why not?
Not only that, but the institution review board also looks at, well, for an example, they just looked at a program that I'm putting on right now called Closing the Gap in Healthcare for African Americans and the Underserved. My program went before the institution review board, and they had to decide whether or not information that we are giving to the African American community is relevant and is it going to hurt anybody. We're just talking about information. And before we could get the grant from that university, the institution review board had to put its stamp of approval on that particular project. So that happens throughout the entire country. Now here's the other thing to consider. I just wrote a health tip the other day trying to encourage African Americans to participate in research, okay? One of the reasons that we very well may be behind on drugs that can affect African Americans in a positive way regarding prostate cancer is because we've not had enough African Americans to be in the study. So when you see a lot of these studies that come out, and you may ask the question, well, how many African Americans did they have in that study? And the drug company will say, well, we didn't have any because we couldn't get any to participate. And this is where information like what you've been studying over the past couple of months, this is where that kind of information has gotten into the psyche of African Americans and has caused us not to participate in medical research.
One of the things, Dr. Bell, is that one of the strong points that Harriet Washington was making was that a lot of these institutional review boards, and I think I recall there being like 5,000 boards across the country, but she was saying that a lot of them are corrupt.
Well, I can tell you in my experience, and my experience is with the Medical University of South Carolina, that has not been my experience. It is not corrupt. In fact, I have served on some of those boards, and I have been impressed that those boards go overboard sometimes in protecting the community from bad outcomes based on the history that we have been exposed to in the past. And so that's why now I spend a considerable amount of time talking to. I have several patients in my practice that I have talked into being in participating in some of this research. There are several things that are beneficial from participating in research. Number one, the healthcare for a designated period of time is free to the person that's participating in the research. That's the first thing. The second thing, even though I don't promote and I don't tell people to do it for this reason, but oftentimes people get paid for participating in the research. Now, and then of course the third thing is that if the research is targeting African Americans to find out whether or not we are going to benefit from X, Y, and Z, I encourage those stations to do that. In fact, here's a piece of information. We just found out, and it's been in the medical literature recently, that African Americans who have a low vitamin D level are more prone when they get prostate cancer to die from the cancer if their vitamin D level is low. This was a study that was done at the medical university. The medical university was one of the leading institutions to do this study. I had several patients to participate in the study. So the study was so overwhelming that they stopped the study. They found out that the men were doing so well that's the other thing. When the study is overwhelmingly positive, they don't keep doing it. They stop it. And they say that, you know, we can stop this study because we now see that based on the early data that people are benefiting from the study. So I just want to let you know that things are not like they used to be 20 or 30 years ago. Things are a lot better. And I think that when we don't participate in these studies, we're doing ourselves a great disservice.
Dr. Bell.
Yeah.
Excuse me, Michelle, if I may. I think one thing that we have a concern with by reading the book is that during the course of reading the book, a lot of different information in recent history. I mean, recent history of different experimentations are coming out. Stuff. You know, one of those things is that the for-profit prisons are basically on the forefront of experimenting. I think at the close of this book, we've been reading it ever since from January the 20th until now. You know, that part of it, as always, with the experimentation and research, it's probably the biggest stickler that me, myself, and probably everyone in this group that we have is like, you know, if we had not read it, we'd probably been more out to volunteer for research, and after we read it, I don't know, not so much. Can you help us process that, if you don't mind, Michelle?
Yeah. Well, one of the things, Jasmine may have told you that I just lost a daughter 3 months of cancer. She had a very rare form of cancer. Okay. One of the things that became very, very apparent to us is that there are medications. There were medications available for her cancer that worked better in white folks, but we didn't have enough black people who had been in the study to find out whether or not the drug would work. So I think that kind of drives home, you know, that kind of drives home my point. What you have read did happen. The only thing that I'm saying to you now, in 2015, the likelihood of what you read in medical apartheid does not happen. And in fact, I'll tell you something. The National Medical Association, which is made up of about 25 or 30,000 African American physicians, one of the main things that they are trying to do right now is to try to encourage African American men and women to participate in these clinical, we don't call them experimentation, we call them clinical trials. Clinical trials as it relates to breast cancer, clinical trials as it relates to prostate cancer. And so we really kind of put ourselves behind the 8 ball when we continue to think that these kinds of things continue happening in 2015. So I know it's hard to get your head around that based on what you have read. But as I was telling Jazzy the other day, I feel fairly confident that those kinds of experimentations do not happen for the most part. And what I would encourage you to do, I would encourage you to go to the NMA, the National Medical Association, and click on clinical trials. They'll tell you all of the guidelines and all of the kinds of things that they do to make people. Am I boring you?
No, I'm listening.
Okay.
No, there's some kind of feedback coming from someplace, though. I don't know where that's coming from.
I hear.
But anyway, so the only thing that I would encourage you to do is open up your mind so that you can think differently. And you know what? You know when this will become apparent to you? When you have a loved one who is very, very sick, and they tell you that there are no medications that work for this particular cancer in this race of people because we don't have enough. We haven't had enough people in the clinical trials for this to work. And that's when it'll hit home. That's when it'll hit home.
But you know, if human beings are fundamentally the same, then is it really necessary to
Absolutely.
Okay.
Yes, sir. One of the things that we found out, and that you're going to notice in the next couple of years, is that while we are fundamentally thing, there are some differences that make some medications work better in us than it does in other folk. We already know that. We already have blood pressure medicines that we know work better in African Americans than they do in white folks. I mean, that's already very, very clearly known. The problem is a lot of our Caucasian doctors don't want to accept that because it requires them to know more about you. You see, so that information is already out there, and you're going to see in the next. Well, you're already seeing it. For an example, a couple of years ago, we found out that a combination of two drugs worked better in congestive heart failure in black people than it did in white folk. All right, it was publicized by white doctors and black doctors. The company went out of business. Now, why do you think the company went out of business? You would think the company would be thriving. The company went out of business. Now, does that make sense? Now, can you tell me why you think the company went out of business?
Because it wasn't getting to enough black people?
Close, no. Well, yeah, that's partly correct, but white doctors did not want to accept the fact that this combination of drugs worked better in black people than it did in white folk, and so they stopped using it.
Wow.
Block, if you give me 1 minute, I'll give you the name of the medication.
Okay.
Yeah, the drug was when the drug company came out with the drug, they came to the National Medical Association and they talked about it. And our cardiologist said that was their that had been their experience with the drug, and they promoted the drug to black doctors. And my gut feeling was that, wow, when they start promoting this drug to white folk, white doctors are not going to use it because they don't want to believe that there are a group of medications that work better in blacks than whites. And that's exactly what they did. They stopped using it, and the company went out of business. The company went out of business because, remember, there are more white people treating black folk than black doctors treating black people. Okay? So that's just a little bit of history that you would not have known about unless you were in the healthcare profession.
Yeah. Okay.
Well, one of the things that I would encourage you to do, if you're really interested in this, check with your local medical school so that you can become a part of that board. Because I can tell you all of this stuff, but when you become a part of that board, and I think that you will be impressed. I think that you will be impressed with the information that the board requires. See, the researchers have to come in, and the researchers have to tell the board that's made up of laymen as well as medical science people. They have to tell what that research is going to be about. Everybody has a vote. So your vote counts just as much as my vote. All right. So before they can, and they have to go through, it has to go through about 3 or 4 different levels. So I definitely would encourage you to become more educated on that, to find out what's happening today as it relates to clinical trials. And based on it's good that you know this history so that we won't have to repeat it. But what I want you to do is don't let the history get in the way of what's going on today. That's what I want you to do. And so in order to do that, educate yourself. Go online at one of these medical schools and find out how do you become a part of that board to review these clinical trials that patients go on. By the way, I want to remind you that I had the opportunity to be a clinical trial researcher. I didn't want to do it because it really does take a lot of time because the guidelines are so strict, and if you deviate from the guidelines in any way, shape, form, or fashion, you mess up the trial. And one of the things that I've been impressed with and that you need to know, if you were going to participate in the trial, at any point in the trial, you have the right to stop the trial. You have the right to get out with no repercussions to you whatsoever. Okay? And if at any point in the trial you have any questions, you have the right, and they encourage you to get an explanation as to what's going on. But so that you become really educated about what's going on, I would encourage you to look into it further. I know the one at the medical university is excellent. It really is.